Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm doing just fine, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, our lone COVID statistic, and a viewer-submitted question through today, May 30th. We invite you to submit any questions you have down below in the comments via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our COVID statistic, average COVID deaths per day for the week of 5/18 was 20. In 2023, the same week, we saw 108 deaths per day. Dr. Murphy, your reaction to that number?
Well, it's the same, the number hasn't changed. So we seem to be at the bottom here in the deaths. That's the only thing we're reporting. We're not reporting new cases. We're not even reporting hospitalizations. But it's still something that's an easy marker to get from the different states and territories, and that's a good number. So we're happy it's here. It may not get any lower. This may be what we have to live with forever, similar with the flu.
Mm-hmm. We will, of course, keep our eye on that number. And we did have a viewer submitted question this week in response to our story about COVID spikes in Singapore across the globe. They were curious if the current strain that's circulating around Asia and causing those spikes is Omicron.
Yeah, well, yes. This whole the way the pandemic is going is there not really two different kinds of viruses floating around. It's all this Omicron variant, and it takes over whatever is there before. This is just a graphic that shows that these new KP2s and 1s, as you see in the upper right-hand corner, they're all related. They're all related to the JN1 strain, which is the Omicron strain. So it may look a little confusing, but it's all in the same family there. It's not like a new Delta or anything like that. So it's the same Omicron strain.
Mm-hmm. And speaking of different strains of things, we have been talking about the avian flu H5N1 for many months now. The newest news this week comes from dairy workers and US and European agencies looking to address this problem. Can you break down the latest for us?
Yeah, so there's more and more attention being paid to this for the reason that we've spoken about in the past, and that avian flu is really lethal to birds. It can infect cows. They don't get as sick, but then they can transmit it to humans, and the mortality rate reported in the past has been as high as 50%. So people are nervous about avian flu, and they should be. But so far, all the cases in humans have come from animals. Humans are not transmitting it to each other. So the three big things that are going on now. They reported last week the second human case. That person did okay. But already 6 weeks ago, the CDC advised farm workers to use personal protective equipment, PPE. And that's basically gloves, goggles, gowns, to protect themselves. Now, farm workers are not used to using PPE. This is very common in hospitals, but not on a dairy farm. So it's been a mixed bag as how well this is rolling out across the country to protect the farm workers. The farmers aren't asking for it. The states are a little bit confused. But anyway, it's there, and they should do it because they are at risk. So that's one thing, PPE. The second is that to transport a cow across the state line now, they have to test negative for H5N1. That's the avian flu. Otherwise, they can't go over state lines. And then finally, there are actually available vaccines in the stockpile that the emergency stockpile the United States keeps, and other countries as well. There are vaccines for avian flu. And so the US is contracting out, other companies are making vaccine. There's a few million doses that are available. But remember, we got 336 million people in the country. If this thing really does, starts to spread and mutates to the point where it can transmit human to human, that is a real possibility. All right. Now, according to the CDC Principal Deputy Director, Dr. Nirav Shah, who's actually from Northwestern originally, he went from here to the state of Illinois under Bruce Rauner. Then he became the director of the state of Maine, and then he ended up at the CDC. And so it looks like he's in charge of this. And he said the decision on how and when to use the vaccine will hinge on evidence of increased transmission, severity of disease, and cases in people with no link to a dairy farm, and of course, mutations in the virus. And so the vaccines all work. They produce antibodies and stuff just like everything else. So that's not going to be any mystery if this goes forward. So he's the guy in charge. We know him very well.
Mm-hmm. So definitely a good sign to see someone you respect at the helm of that part of the decision. But
Right.
there's another study that's come out about not flu vaccines, but COVID vaccines,
Right.
and specifically in a group that is one of the hardest to protect against not just COVID, but pretty much all infectious diseases. Can you tell us about this research?
Yeah, this is looking at the mRNA vaccine for COVID in solid organ transplant patients. They got a kidney transplant, liver transplant, something like that. They're on a lot of immunosuppressants, and they don't do well with COVID, and they don't respond to the vaccine very well. So they did this study at 16 different US sites, and they looked at the efficacy of basically 2, 3, and 4 doses compared to people that don't have an organ transplant and are otherwise normal or have a normal immunologic response. And they looked at these, and when the first dose is given, there's a response, but when the second dose is given, the organ transplant patients don't do very well. And we've known this for a long time. However, they continued to study these patients and gave them 3 and 4 doses. And what they found is that the solid organ transplant patients with multiple doses do sort of almost catch up with the immunocompetent people. So that's a really good sign, but it takes multiple doses for that to happen. Now, early on in the pandemic, when we were just giving the 2 shots, we didn't know when there was going to be a third one. They started giving multiple doses to these patients, and that ended up being a very smart idea. And now we have the data that show that it really, really works. Now, what does that mean for you and me? We don't have organ transplants, and most people don't. What it means is it shows that those 3rd and 4th doses actually do give an extra push in the whole thing. They really help the immunologic response. So it's just very fascinating data, and it's good news for the organ transplant patients that they know that they can be protected if they keep up with their vaccination schedule.
Yes, it's a very, very difficult situation for people with very serious medical history, and working to close that gap of severity between those patients and the immunocompetent patients is very important.
Mm-hmm.
Now, another COVID story, a little bit of a different angle. The WHO recently released their report on life expectancy gains and losses on the global scale. And the COVID-19 pandemic played a big role in that. Can you explain that?
So, life expectancy is a well-known uniform marker for the overall health of a population. You can look at it by country, you can look at it by gender, you can look at it by race or ethnicity or You could look at it in many, many, many different ways. And if you look at the entire world, with the billions of people in the world, it's pretty easy to get the life expectancy of the world. And so if you ask anyone, you know, a lay person on the street, whatever, how old do you think the average person in the world lives? Hardly anybody gets it right. Because in 2000, the life expectancy, this is just 24 years ago, the life expectancy was 66.8 years of age. By 2019, pre-pandemic, that had risen to 73.1. So the average age in the world is over 73 years of age. I mean, I think people will think that's high. I mean, 73 is pretty good for the world, you know? So what happened with the pandemic? Well, of course, the pandemic was, you know, a disaster overall, and life expectancy began to drop. And it dropped to 71.4 years from 73.1 in 2021. And the effects of the pandemic were seen mostly in the middle and high income countries. So the wealthier the country, the bigger the drop was. But the reason for that is that the average, first two reasons. One is that the average median survival is higher, so you have further to drop. That's one thing. But the other big difference in the high income countries is that they're old. They're older. They have an older population. And we've known from the beginning with flu and many other infections and many other diseases, the older you are, the higher the risk for dying. For instance, just take, I won't name the country, but I mean, you could take an African country, low income, low middle income country. The typical median age, in other words, where half are below and half are above, is around 18 years. Very, very young populations. The United States is 38, and we're on the low side for the high income countries. So other countries are even higher and getting higher. So that 20-year difference, you know, shifts the risk for dying of COVID in really well. There's other reasons as well, but the big driver is age. So in a young population, the COVID pandemic doesn't have that much of an impact, relatively speaking. But anyway, the numbers are coming back up, and you know, we're almost back to where we were.
Mm-hmm. That is incredibly fascinating.
Yeah.
One other story that we've been talking about a lot that has been a little mind-boggling is Mpox globally and specifically here in the United States. We have a vaccine here that is very underutilized, as we have talked about in previous episodes. Can you tell us about the new CDC report that was released regarding infections and vaccination?
Yeah. So there's been 32,000 Mpox cases reported from May 2022 to May 2024. And if you look at those cases, less than 1%, it's actually 0.8%, were in vaccinated people. I mean, it just shows you how effective this vaccine is. Then the sad thing is, only 25% of people at risk have taken the vaccine. So again, you don't take the vaccine, you get Mpox. Now, Mpox is not as lethal as COVID, but you know, Mpox is very disabling, painful. It gets, you know, because it's a contact spread, you know, they have to be in isolation. It's not a pleasant disease to get, but it just goes to show you these vaccines actually can work pretty good, and it's targeted for people at risk.
Absolutely. And important to note that after you get your full 2-dose series, you don't need a booster for another 2 to 10 years, depending on
Yeah,
your
we don't
risk
really know.
level.
They're going to follow those patients and see when their antibodies go down, if they do go down.
Yeah.
You know, with smallpox, after the smallpox vaccine, you don't need any boosters.
Mhm.
And matter of fact, older people like myself I had the smallpox vaccine. So, older people may actually still have protection because they're so related.
Mhm. That's very interesting. We'll keep up on the Mpox stories, keeping up with those case numbers, as well as hopefully increasing vaccination numbers. But our final story for the day, coming back to the birds, as if poultry didn't need any more bad press, there was recently announced a salmonella outbreak linked to backyard poultry flocks. Can you tell us a little bit about this outbreak and how it may have happened?
Yeah, so Thursday last week, the CDC released a warning for salmonella. That's a bacterial infection that's linked to backyard poultry flocks. People have chickens in the backyard or turkeys or whatever. And 109 people got sick in 29 states. It's happening, 33 of them ended up in the hospital. Nobody died. You can die from this, but nobody died. So about a third of the people ended up in the hospital. That's how bad salmonella is. Now, the median case, half are below the age and half are above, is 10. So it's mostly happening in children. And 43% of the cases actually in kids under 5. So the illnesses go back to about February of this year. Salmonella is a reportable disease, so that's why you get this information comes up, and that's why it's important that the CDC is collecting data from all the states and territories. So most of the people had contact with backyard poultry, or were buying poultry or poultry products from multiple retail stores. But there was no like common store. That's just an interesting, infection that is out there that can be very severe. 1/3 end up in the hospital, and people can die from it. And so the advice at this point is if you do get sick or you have a weakened immune system, you should be careful. If you get sick, you should think this, especially if you've been exposed to poultry, and like typical people with the backyard poultry conditions. And if you are exposed, they just advise wash your hands after touching backyard poultry and their eggs. Supervise kids that are around flocks of those animals, and to refrain from kissing or snuggling with backyard poultry. I mean, some of the poultry people that have chicken farms, they have like their favorite chicken, and they have physical contact with them. You should try to avoid that at this particular time until this little mini epidemic goes away.
Mhm. On that note, I'd like to thank you, Dr. Murphy, for your time, your expertise in answering our viewer submitted question, breaking down all of this research. It is much appreciated.
Well, thank you, and have a good weekend.
Thank you. And thank you all for joining us for another episode of the Ask Dr. Murphy series. We thank you for joining us. If you have any questions, please feel free to comment them down below or contact us through any of our social media linked in the description. We'll see you next week.
See you next week.